Hello student, welcome you to massive open online course on Indian economy. Today I am going to discuss the module entitled Social Protection Program in India compared with other countries of the world. After completing this module, you are able to know the concept of social protection program as well as social protection floor, the evidence of social protection program in India, and you are also able to know the coverage of the social protection program in the world including India. The module consists with 6 sections. Section 1 introduces the background of the social protection program, whereas Section 2 is the perception of the social protection, where I will discuss the concept of social protection program, the concept of social protection floor, as well as the consequence of the COVID-19 in the context of social protection benefits. And Section 3 is the evidence of the social protection program in India, whereas Section 4 analyzes the coverage of the social protection program in the world including India. Section 5 also analyzes the coverage of the social protection program across different branches of the social protection scheme in India as well as other countries. And finally, Section 6 is the conclusion. First of all, we try to understand the background of the social protection programs. Social protection means the government measures for the benefit of the people. If we consider economic growth as well as sustainable development goals, then this inclusive economic growth and sustainable development goal cannot be possible purely through the promotion of the economic growth as well as through the development of the physical infrastructure, because in the growth process a section of the people are always excluded. Side by side, a section of the people are also not able to take advantage of the physical infrastructure. Therefore, the direct intervention are important to overcome the problem of poor as well as vulnerable section of the society, to overcome their problem from poverty, from food insecurity as well as from other form of deprivations. Therefore, around the world there is a recognition for implementation of social protection program to overcome the problem of poverty, food insecurity and other forms of deprivation. Now, what do you understand by social protection program? Social protection program can be defined a set of public measures, a set of government measures for the benefit of the people. ILO, Indian Labour Organization, they have defined the appropriate measure for the or appropriate concept or definition for the social protection programs. According to ILO, social protection comprises those measures which aim at preventing, reducing and eliminating economic and social vulnerabilities to poverty and deprivations. That is, social protection programs is able to reduce, prevent and eliminate the poverty and other form of deprivation for the poor as well as vulnerable section. In broader sense, social protection means a set of public measures that society provides for its member to protect them against the economic and social distress. In simplicity, we can understand social protection program means the government measures, the government program and policies that create benefits for the people. Now we come to the concept of the social protection floor. Social protection floor is the combination of all social protection programs that are available in a country and that are enjoyed by the people across their life cycle. According to United Nations, social protection program or social protection floor is defined as an integrated set of social policies that are designed to guarantee income security and access to social services for all, paying particular attention to vulnerable groups and protecting and empowering people across the life cycles. That is, social protection floor is an integrated set of all available social protection program in a country, and the purpose of the social protection program is to protect the people from the vulnerability. And this social protection float consists with two types of program. One is one types of program related with basic income securities, whereas other types of program related with universal access to essential affordable services. In case of basic income securities, the program related with mainly income support as well as employment support program. Side by side, the service for the unemployed and working poor, and pension for the elderly as well as person with disabilities, and also child related benefits. These are related with the basic income securities, whereas in case of universal access to essential affordable services, the program mainly extended for the entire population, therefore they are called the universal access to essential affordable services. And in that case, the social protection program mainly related with the provision of food, for health, for education, for drinking water and sanitation, as well as other types of benefits according to the national priorities. And these social protection float are available across the life cycle of the people. It is available for the children, it is available for the working age population who are unable to earn any income or sufficient income, as well as for the elderly and people with disabilities. And this different group of people across their life cycle, they obtained the benefit related with food security, health facility, education facility, housing, water and sanitation, income support, as well as social assistance. Therefore, all these types of social protection benefits which are available for the entire life cycle or across the life cycle of different group of people are the social protection floor of a country. And this social protection floor, that is the breadth and width of the social protection floor, also varies from one country to another country. Section 3 is the social protection program in the context of the COVID-19 pandemic. We are all aware about the COVID-19 pandemic and its consequence specifically on the life and livelihood of the people. Therefore, during the COVID-19 pandemic, most of the government or most of the countries depends on the social protection program to overcome the problem of the people, that is to overcome the problem of their livelihood, to create the benefit in the form of income, in the form of employment generation, as well as in the form of health facilities. Therefore, during the COVID-19 pandemic, you are all aware about the importance of the social protection program. At what extent social protection program able to overcome the problem of COVID-19 pandemic can be understood if we consider the extent of social protection coverage of different countries. And there is the recognition is that the previous concept of the social protection program or previous coverage of the social protection program are not sufficient to protect the people in the crisis situation. Therefore, many countries have arrived at a crossroads, and they are moving in favor of the high road rather than the low road in the journey of social protection program or social protection benefits. In the low road, actually social protection program, there is the less investment in the social protection program, and social protection system mainly neglected, and this is negligence due to the underinvestment, austerity and undue fiscal consideration, and minimal benefits to insufficient, as well as weak coordination among different branches of the social protection program. Therefore, to overcome the crisis, most of the countries are moving in favor of the high road, where there is the scope for strengthening the social protection system, and this high road provision of the social protection system requires universal coverage of the social protection program, adequate benefit levels, a comprehensive range of benefits, sustainable financial system, provision that is right-based and inclusive, as well as adaptation to the developments in the world of the work. Therefore, to strengthen the social protection system, these are the requirements, and by the implementing these, a country can able to move the high road path in the implementation of the social protection program. Now we come to the evidence of the social protection program in India. After the liberalization in the year 1991, for the time being, the social protection program was neglected in India. But since 1995, social protection program was also important in our country, and that can be understood with the high share of the government spending in case of employment generating program as well as in case of the rural development. And specifically during last 2 decades, the government introduced a number of social protection program to overcome the problem of the people in our country, and some of this program are now legally enforced, legally entitled. That is, there is that some of the programs are called the right-based program. For example, Right to Education Act and right to work by the means of MG Narega, Mahatma Gandhi National Rural Employment Guarantee Act, as well as National Food Security Act of 2013. These programs are also introduced by the legal provision, and people have right to get benefit from this program. Accordingly, the spending of the social protection program also gradually increased in our country. In the year 1995-96, the out of total expenditure, if you consider percentage share of expenditure on social protection program to total GDP, then this share increased from 1% in 95-96 to 1.7% in 2011-12 in our country. This increase of the provision of financing for social protection program indicates that the coverage of the social protection program also increased in our country. If we consider the social protection floor in our country, then the social protection floor varies from one country to another country, and there is the evidence of the different types of program which create the integrated part of the social protection floor. In case of India, the social protection floor, specifically for the basic income securities, there are different types of program. Some of the program related with income and employment benefit. For example, Mahatma Gandhi National Rural Employment Guarantee Act. The program related with SGSOI, Swarna Jayanti Gram Swarojgar Yojana, non-timber forest product. These programs are mainly related with the income and employment generation in our country. Side by side, there is also the evidence of the program for the benefit of the special section of the society, and this program is also treated as different types of pension scheme. For example, National Old Age Pension Scheme, NOAPS, National Disability Pension Scheme, National Widows Pension Scheme, as well as National Family Benefit Scheme. Side by side, on the other hand, there is also the evidence of universal access to essential affordable services in our country by the means of targeted public distribution system for the food security, and for the health, it is by primary health services as well as Rashtriya Swasthya Bima Yojana, and its modern version is Ayushman Bharat and Janani Suraksha Yojana. In case of water and sanitation, the programs like National Rural Drinking Water Program and TSC means Total Sanitation Campaign, and its modern version is Swachh Bharat Mission. For education, the programs are ICDS, Integrated Child Development Scheme, SSK, MSK, Mid-Day Meal, etc. Similarly, there is also the program for the housing scheme. For example, Indira Awas Yojana or its modern form, Prime Minister Awas Yojana. These program create the depth and extent of the social protection floor in our country, but the list of the program are not exhaustive here. So many other programs are there. Here I have only cited some important programs. Along with this, a different state government in our country as well as central government also introduced a number of social protection programs during the COVID-19 to overcome the problem of the life and livelihood in our country. All these programs are the part of the social protection floor. Now we analyze the social protection coverage across the world, across different regions of the world, including our country, India. The social protection coverage can be understood by the percentage share of people who obtained at least one social protection benefit. Out of total population of the world, 46.9% people only obtained effective coverage of at least one social protection program. This is the estimation of the International Labour Organization ILO in the year 2021. In their report, they have estimated that 46.9% global people are effectively covered by at least one social protection program. But remaining 53.1% people are not covered any social protection program. There is a huge gap. But if we consider the coverage of the social protection program across different regions of the country, then there is a wide variation of the coverage of the social protection programs. It is relatively high for the region of Europe and Central Asia, and it is substantially low for the Africa. In case of Europe and Central Asia, as many as 83.9% people are effectively covered by at least one social protection program, whereas in case of America, this share is 64.3%. In contrast, in case of Africa, only 17.4% people are effectively covered at least one social protection program. In case of Arab states, the share is 40%. In case of Asia and Pacific, the share is 44.1%. India is a country located in the region of Asia and Pacific. In case of India, the share is 24.4%. That is, out of total population in our country, only 24.4% people are effectively covered by at least one social protection benefit. The share is relatively low compared to other regions of the country, and it is slightly higher compared to the coverage of the Africa. Along with this effective coverage of the social protection program, there is the provision of the health coverage, and in our country 20.2% people affiliated to the social health protection scheme. This share is also relatively low. The remaining 80% people are not affiliated to the social health protection scheme. There is a huge gap in respect of the social health protection scheme. For the implementation and extension of the social protection benefit, the fund is very, very important. That can be understood by the public expenditure on the social protection scheme. We can measure the public expenditure as a share of the GDP, and this share for the global average is 12.9%. That is, out of total GDP of the globe, 12.9% is used for the financing of the social protection program, and these shares is widely varied across different regions of the country. For the high income countries, the share is 16.4%, whereas for the low income countries, it is relatively very low, 1.1%. That is, in the low income countries, out of total GDP, only 1.1% is used for the social protection benefit. In case of upper middle income countries, the share is 8%. In case of lower middle income countries, the share is 2.5%. In case of India, in our country, this share is also relatively low, 1.4%. That is, out of total GDP, only 1.4% is used for the social protection program. Now we come to the coverage of the social protection program across different branches of the social protection scheme. There are different branches of the social protection scheme. Some are related with old age pension, some are related with unemployment, some are related with child, mother, etc. This is the global scenario. Across different branches of the social protection program, the coverage is relatively high for the older person. As many as 77.5% of the global old people are effectively covered by at least one social protection program. But this share is relatively low for the unemployed who lost their job, as well as for the children. In case of children, the share is only 26.4%. That is only 26.4% children of the world are effectively covered by at least one social protection program. In case of mothers, the share is 44.9, and persons with disabilities, it is 33.5, whereas in case of workers with work injury is 35.4. Side by side, it is also true that the coverage is also relatively low for the vulnerable section of the society. The global average is 28.9%. But this effective coverage also widely varied across different regions of the country. This figure helps us to understand the contrasting features of the variation of the coverage of the social protection benefit in two specific region. One is Asia and Pacific, and another is Europe and Central Asia. The red bars are the representation of the Europe and Central Asia. In across different branches of the social protection scheme, the coverage of the Europe and Central Asia is significantly higher compared to the Asia and Pacific. In most of the cases, the coverage is nearly 75 to 80% and more than that. And there is a huge gap, particularly in case of the children, where only 18% children of the Asia and Pacific are covered by any social protection program, and this share for Europe and Central Asia is 82.3%. Similarly, in case of older person, as many as 96.7% old people are covered by at least one social protection program in Europe and Central Asia, whereas this share is 73.5%. Not only that, some of the countries in Europe and Central Asia are able to extend universal coverage of the social protection benefit for their older person. Now we come to the effective coverage of the social protection program across different branches in our country. Here there is no coverage of the for the unemployed person. The share is 0. That is, the worker who lost their job, they are not able to obtain any social protection benefit in our country. Side by side, the coverage for the disability is also relatively low. It is only 5.6%. For the workers with work injury, also relatively low, 3.7%. In case of children, the share is 24.1%. For mothers, it is 41.5%, and for older person, it is 42.5%. And in case of different pension scheme, other than old age pension, the share is 31.5%, whereas universal health coverage is 55%. That is, across different branches of the social protection program in our country, there is a huge gap. A significant portion of the people are not yet covered by at least one form of the social protection program. This table helps us to understand the extent of the coverage of the social protection program in India vis-a-vis other South Asian countries. Here we have considered the South Asian countries And among the South Asian countries, the effective coverage, the aggregate coverage of India is relatively higher than other 5 South Asian countries, say for Afghanistan, Bhutan, Maldives, Nepal and Pakistan. Whereas the effective coverage is relatively high in case of Bangladesh and Sri Lanka compared to India. In case of Sri Lanka, 36.4% people are covered by at least one social protection program. In case of Bangladesh, the share is 28.4%. In case of India, this share is only 24.4%. Not only that, in case of children, the Bangladesh and Sri Lanka, the share of Bangladesh and Sri Lanka are also higher than that of the India. In case of Sri Lanka, the share is 32%. In case of Bangladesh, the share is 29.4%, whereas the share for India is 24.1%. Similarly, in case of persons with disabilities, the coverage of the Bangladesh and Sri Lanka are also higher than that of India. Whereas in case of older person, Maldives is an exceptional. They are able to extend the universal coverage of older person. Their share is 100%. Side by side, there is also huge variation of the effective coverage of different social protection scheme across the South Asian countries, and in compared to other neighboring countries, the position of India is also not good. India is lagging behind in respect of a number of social protection scheme compared to other countries. Therefore, a course correction is needed. It is true, in our country, there is the evidence of a number of social protection programs introduced by central government as well as the state government. But it is also true that huge corruption and ineffective management for the implementation of the social protection program, the desired outcome is also not good. For that purpose, a course correction is needed to overcome the problem of the effective implementation or effective benefit of the social protection program. And after this course correction, India can able to achieve the effective benefit of the social protection programs.